Are we gonna, so just to clarify, there's 21 people participating, but we're only gonna be able to see the panelists. Okay, because it's a webinar. Great, thank you very much. Welcome everybody. I'm not sure exactly who I'm speaking to. I know, oh, Jesse Jones, you are in the meeting. Yeah, maybe if you guys could, if you take a minute in the chat to, you know, identify yourselves, because I think I know most of the people who are on here, but it's nice to just see your names if you have a minute. Thank you for being on here, Mr. Jones and everybody else. I want to just take this opportunity to thank everybody for being on this call and for everything that you've been doing in this past year to support the young people of Knoxville. It's been a really difficult year with the pandemic, and then with so much uncertainty. And then of course we've had tragic surge in violence that has traumatized so many people in our city and claimed the lives of too many people, including 5 young teenagers in our city. So thank you for continuing to lift up the families and children you serve and doing what you do to help heal and recover. So I want to thank you, especially because we are all here together to help stop the violence and interrupt the violence. And we know that there are evidence-based strategies to do this, and tonight is another step in that direction to continue our efforts to interrupt violence in Knoxville. And one key part of that is collaboration. To build together an effective violence interruption strategy, it needs to be well-planned, well-resourced, and suitable for Knoxville. What works in Louisville or Denver or Minneapolis or Baltimore, some parts of that might work in Knoxville, but we are unique. We have unique talents and capacities and unique needs. So we need to make sure that the strategies that we come up with together are what works for Knoxville. I'm very committed to increasing communication, building trust, and working together to strengthen existing programs and to create new ones to address the causes of violence in our community. Violence interruption work is very important work, and we again are fully committed to finding solutions. This work will not replace existing programs, but will work alongside and in coordination with the good work that is already happening in our community. Violence interruption is I was on the new Mayor's Youth Council. I had the inaugural meeting last night, and one of the students asked me, what is the #1 issue facing Knoxville? And I said violence, and they all agreed. So violence interruption is a top priority for me and my entire administration. We have already allocated $1 million to invest in this work, and we're going to continue that $1 million into the new budget year is what I've proposed, and I know council's supportive. We've already launched Crime Stoppers, which is helping follow up with after crimes to get information and giving people anonymous ways to give tips about solving crimes. We're launching a summer youth opportunity grant pilot program. And really importantly, this work is above and beyond what the city's been doing already. So I'm proposing, and hopefully we'll get funded, a project manager who gets a full-time job working for the city of Knoxville, working with all of you, whose sole focus every day is violence reduction and interruption. We have expanded our relationship with Cities United to provide technical support and capacity building. Many of you know that the city's relationship with Cities United goes back to 2012, not long after the organization was founded by former mayors of Philadelphia, Michael Nutter, and former mayor of New Orleans, Mitch Landrieu, both of whom I've had the opportunity to work with this year. With guidance from Cities United, my esteemed predecessor, Mayor Madeline Rajero, convened a local advisory group to look at the violence in our community and the disproportionate impact it was having on our city's young Black men and boys of color. Many of you already know Andre Canty. Hello, Andre. He's now of Cities United. He's born and raised here in Knoxville and has been part of these discussions all along, including the activities and efforts that have followed. He helped, along with many people in the city, form our Save Our Sons initiative, which helped identify and address disparities in our community. Andre has been a champion of forming a youth council for a long time, as has Kathy Mack, and I'm really excited that that part of our outreach is underway. We have our first ever Mayor's Youth Council, and I had the pleasure of meeting with them just last night, and they're a creative, thoughtful, and engaged group of young people they're eager to get involved, and I look forward to working with them and hearing more of their ideas. And I have to say, they have great ideas, and they also understand that these, unlike many adults, the kids on the youth council understand that these problems didn't develop overnight, and they're not going to be solved overnight. So I appreciate their understanding that, of course, it's urgent and we need all hands on deck, but that we can't snap our fingers and make the problem go away. So tonight I'm excited to share a video from Vine Middle School 8th grader Shermija Whitehead, a member of our Mayor's Youth Council, whom I met last night, and you will hear in her words how violence has directly impacted her. And just so you know, after the video, I will be signing off. I'm not staying on the webinar intentionally, not because I don't want to participate, but because sometimes I know when the mayor's on the call, that can, you know, just affect affect the conversation, and maybe in ways that people aren't as open as they would be if I'm not here. So I will encourage you all to be fully engaged. This is an important conversation about interrupting violence in our community and improving outcomes for the young people of Knoxville. So thank you for being here. And just know that I'm deeply committed to this work. This is what our work is all about. This is what keeps me up at night when I think about the violence in our community and how we need to change that trajectory and bring hope and encourage our young people that they have a bright future in this city. So thank you. I'm going to turn it over to Kathy, I guess. Are you, or Debbie, one of you, to I guess take us to our video later, or whatever the next steps are. Thank you very much.
Debbie, we can't hear it. I'm sorry.
Can't hear it?
I keep going for her. Like, I run track for her. I dance now for her.
If you can start it over, we can hear it now. If you'll share it and start over, we can hear it now.
Okay, sorry about that. I don't know what's happening.
It says that you may have to start a new share.
Can you see it now?
We can.
So it's definitely left a doubt. Can't be built, but I know that she's hearing my presence.
We can't hear it.
I think I figured it out. I'm muting myself.
Okay.
Hold on, we'll start it again.
So it's definitely left a doubt. Can't be built, but I know that she's hearing my presence. I keep going for her. Like, I run track for her. I dance now for her. It's gonna, her name will forever live on. It makes me cherish life way different now. Anybody can be gone at any time. I was just at practice with this girl 2 days ago, before it had happened. So in a positive way, it tells you to keep going. If you feel like you should do something in that time, do it. Do not think, okay, I can do it tomorrow. No, do it now. Traumatizing. Because it's more so a nightmare and you can't really get out of it. It put a dark spot on you forever. Like, you will grow up knowing it was somebody named Nana. You may have kids and know Nana would have been around. This would have been her godmama, her auntie, her cousin. So it put this block and you can't really push it down. So I mean, yeah, I would say traumatizing, definitely.
Thank you. Debbie, thank you for sharing that video. As you've heard, that's Shamaja Whitehead. She is a member of our youth council. We found that it was imperative to have a youth voice and presence in this meeting. Our youth have been highly affected by the violence here in our community. One of the things that I wanted to make sure that we brag just a little bit on our youth council. Again, it's a newly formed council with some amazing change makers. These young people are ready and ready to be moved into action. One of the things that we will say about our young people is a very diverse group. They're ready to have a voice in the government decision making, and it's not when the time is right, the time is now for their voices to be heard. So thank you all for allowing us to play that video. Earlier, you all heard the mayor speak about the $1 million funding. Again, the funding is going to be some of the funding has been already allocated to Crime Stoppers, the launching of our summer youth opportunity grant pilot program, hiring of a project manager that will focus directly on violence reduction, our contractual agreement with Cities United to provide technical assistance. And again, we will be also working with United Way and the county to leverage private giving also to support this work. We literally wanted to take this time in this space to share with you all. It's all about information sharing and awareness on today. We are working to schedule an in-person stakeholder meeting for anyone who wants to be deeper involved in this or deeper involved and engaged in this work. So if that's you, please email me. My email address is kmac@knoxvilletn.gov. You can text or call me. My phone number is area code 865-684-6565. Not only are we looking to develop this stakeholders group, which we also in this group are going to be able to identify and discuss strategies, asset mapping, and the development of working groups. But we also want you to participate. We want you to be involved. We cannot do this work without the involvement of community. I know I've mentioned some of the allocation monies that have already been allocated, but we also want to still be in conversations with you around building and resourcing violence reduction in Knoxville. So we are excited about tonight. Again, this webinar is being recorded. We will take Q&A at the end. If there's anything that you would like to say, if you would put it in the chat. Also, if you will list your organization and the work that you are already doing around violence interruption, we would love for you to post that in the chat. Again, we welcome you and we thank you for your time on tonight. This work, again, as the mayor has iterated, is very important to us in our city. Violence is not new to our city, but the timing is right. The timing is now. So let's work together. At this point, I'd like to turn it over to Andre Canty, who some of you already know. It's an introduction to some, and to some you already know. So thank you so much. We look forward to hearing from you.
All right. Well, appreciate that, Kathy. Appreciate the framing a little bit. American Canon. Some of that I may skip since you said it already. Yeah. So just some housekeeping. It is around 6:15 and it is around dinner time. So my task is to be three things. I got this from the speaker when I was the president under Black Men. I'll be good, I'll be brief, and then I'll be gone. But it'll be to around like 7 or 7:15. Normally use a draw, right? They'll normally use a draw, right? So my purpose is to not only like let you all know what's going on, give you some examples of what has worked. But most important, I want to leave you all with some hope, some empowerment. It has been heavy, as American Cannon said. It is also nationwide. And there's many factors towards that, but we're gonna get through this together. I'll just say that. So like everybody said, this is me. My official title with Cities United is Senior Associate of National Initiatives. Yes, the title is long, but it deals with all of our stakeholders, which includes city leads, city mayors, community-based partners, young people, and at the core, young Black boys and their families. Also a little bit about me, for those who may not know, and a reminder, my previous job was at the Highland Research Education Center. which is a place that's been around since 1932, that builds social justice movements across the South and Appalachia. I was also, as I said before, the president of 100 Black Men. I was one of the co-founders of Stop School Pushout, the co-chair of the Disparities Educational Outcomes Committee, and various other things. I was a youth organizer as well. So basically, I've done it all. I've seen it all, and I had the T-shirt, right? So my kind of gift is talking with a whole cross section of people, and it really came from my grandfather. That's how he organized. So I got it from him. So it's kind of like, you know, and I'm also, like people said, from East Knoxville, Woodbine, East Fifth, Townview, MLK. That's where I come from. So it's what we do, right? So Cities United is committed to working with city, community. I'll say this again, city and community, and young leaders to reimagine and redefine public safety. A little about the history. I won't go a lot about the history of Cities United, but I really want to set a framing, right? And I may go back and forth because I'm trying to look at time. I don't have you all day and all night, right? So a little bit more about Cities United. American Ken already talked about like the history, but the vision is creating safe, healthy, hopeful communities for young Black boys and their families. The mission of Cities United is supporting a national network of mayors who are committed to ending the epidemic of homicides and shootings of the same population, young Black men and boys ages 14 to 24, about 50% by 2025. Though that's our particular mission, we work with cities who address violence reduction with a multi-sector of populations. This is our particular mission, is with Black men and boys, but we work with everybody. The core values of Cities United: social justice. I want to make that known. Social justice. It's equity. It's youth voice. It's collaboration, innovation. Our primary objectives is national movement and field building and coaching and capacity. And American Ken already said it, kind of like our history. This is not a new partnership. It's been around for a couple of years. In fact, Knoxville was the site for the Cities United National Convening around 2018, which was mainly at the Change Center, So, and everything else, you know, American Ken already said. So first it was Save Our Sons, now it's Empower Knox. So not much has changed, contract or not, right? So we've always been around. So before I get to the problem, I want to just say this out loud. We are here to honor and fight for the kids that we lost last couple of months. You know, Brother Muhammad, Brother Taylor, Brother Freeman, Brother Thompson, Brother Gillette, and lastly, our Sister Muhammad. Not only for those young people, but for me is also my mentee, Xavier Dobson, his cousin Jawan Latham, Uniqua, going all the way back to Brittany Daniels in 1995. That was when I first saw the violence in East Knoxville. I wanted to do something about it. I was 10 years old, but I just had this feeling to do something. So all those lives from 1995 up until now, something has to change. It has to be innovative, it has to be collaborative, and it needs all of us. I said all hands on deck a month ago. That's what I mean. So we're here for all these kids and all the people that are not here today. And there's this quote by the rapper AZ who said, "I'm living out the dreams for all the people who never made it this year." That's why we're here. So a little bit about the problem. So what are we dealing with? The rates of fatal and non-fatal violent victimization of young Black males are far higher than anybody else. And you see by the chart right here, Black males between the ages of 14 and 24, you can see they're way higher than everybody else. Comparable to white males, 14 to 17, also same thing with 18 to 24-year-old white males. But as you see from the chart, they're mostly Black males. Though again, Black women are also affected by this, not just by the actual shootings, but the mothers, the sisters, and the community at whole, right? Also, it's not just community violence, it's also police violence. So according to the gun violence archives, between, let me see, like the chat, see, there we go. Between 2014 and 2020, there's been approximately almost 14,000 officer involved incidents. So from last year to Breonna Taylor to George Floyd, even what happened after the acquittal, not the acquittal, but the guilty verdict of Derek Chauvin, Sister Ma'Khia Bryant in Columbus, Ohio. So as everybody was marching, the globe marched last year for a change, and that change is public safety and reimagine it, right? So whether it's community violence, whether it's police involved shootings, Black people are getting hit the most by disparities, right? That's what we're dealing with. So this is like a slide of how everything intersects. So like root causes, it's poverty, it's trauma, systemic unemployment, state violence, did not just include police involved shootings, but other ways of killing Black and brown folk, right? And racism. It's racism, right? Just gonna call it what it is, right? All of those intersect, and those are all root causes. At the center, this is how community violence forms. So it's not some innate desire for these kids to kill each other. This is a result of under-resourced communities, education, healthcare, and lastly, just racist institutions. What a solution. So Cities United see the solution in 3 ways. Interrupting the cycle of community violence. So that deals with the more individual based, which I'll get to a little bit later. Dismantling the system of inequity. As I said before, all those root causes that I talked about, bad policies and practices that have been affecting us almost since the beginning of the time, has contributed to violence. So how you dismantle those systems of inequity. And lastly, how do you invest in the sustainability of all this work? So no matter whether I'm here, you all are here, who's in office, who's not in office, and this work will remain. And the emphasis on us working ourselves out of a job. I don't want to talk about this 20 years from now. I'm sure you all don't either, right? So how can we invest and make sure this work is sustained? And that's through policy, that's through practice, that's also through community engagement and also community empowerment as well. And we look at things in a public health approach. Like anything else, there's been a charge to identify community violence and violence in itself as a public health crisis. And how to get to that approach is defining the problem, identify risk and protective factors, develop and test prevention strategies. So that goes into like evidence-based strategies, and ensure widespread adoption. So when these evidence-based strategies are developed all across like the nation, just make sure that everybody's on it, okay? So a little about what Cities United does and my particular role in it. I have many roles, but we do a lot of training and technical assistance, and we do it through 6 milestones. So it's like a journey, right? It's a roadmap, taking the road by walking. That's said at Highlander all the time. So like any story, we got to start with what's the call, what's the problem. So the first milestone is the data story. What is the story of Knoxville? And not just the bad stuff, right? Not just the killings, the shootings, and all the bad stuff, but what are the community assets? Who are the people that's already on the ground, that's already doing stuff? What are the great things about Knoxville, right? The protective factors, that goes to the story of Knoxville and just the story of the city, period. And then next is, and I'll talk about this throughout this entire presentation until I'm blue in the face, is engaging key stakeholders. Not just to be there as witnesses, but as participants and a lot of times drivers of what the plan will be and how it should go, how it's evaluated, how it's governed, and all that kind of stuff. Not me to be meeting, but to meet the work, right? And from that, once these key stakeholders are kind of formed, just the emphasis on that to include the people most affected. So the people within, East Knoxville, Lonsdale, Mechanicsville, not just the people who are hit with the disparities, but also the people that's directly impacted, the families. And we're looking at both sides of the gun, both sides of the gun. Schools, is faith-based folk, right? Is foundations, is all these people, all right? Selected officials as well. But after all these people are formed, where are you going to go? So it goes into identifying strategic directions. So what is the mission, vision, the goals of these stakeholder groups? So again, not to be meeting, but it's about a start and an end goal. Where are you going? And that goes into policy, program recommendation, that goes to a lot of things. The next milestone is identify oversight and accountability measures. So, just say we have some programs popping, some initiatives popping. Well, they can't just be doing it, right? So the oversight and accountability measures are extremely important. It's community driven, right? Park is like kind of the example of that. The DEO task force is kind of like that, but really it should be community that's, that should be co-owning this more than anything else, because they're on the ground, they're most affected. Honestly, it's their money, right? It's their money. And then with that, kind of the segue, align secure resources. And it's not just money, it's also people, right? So when that, not just like city, but it's also county. It's county resources, and some places even have like state-based kind of advocacy, because that's important too. Because ideally, and this will be my story, not anybody else's, that community violence should really be a state issue. That Knoxville, Chattanooga, Nashville, Memphis, all counties in between, this should be as important as anything else, right? We want to keep these people alive. And then lastly, implement a comprehensive public safety plan from A to Z. How are you going to do it in Knoxville, right? Who's going to be driving it? What's the problem? How are we going to solve it? And again, lastly, is the public safety planning. So, and we're there just to, just provide that training and technical assistance. It's kind of what we do. So, this is not random. There's a method to my madness, right? So, technical and training assistance, with the emphasis on, we do not do the day-to-day operations. So it comes street outreach, violence interruption, stuff like that. We don't really get into all that, right? It's more like the infrastructure of like building capacity for the city, the core team, so the people like within the city more than anything else. Of course, personally, you all have known me to be an organizer and activist too, right? But in this case, I'm more like the guy on the right. So the guy on the right is, he was a defensive coordinator for the Vols, Chris Rump. Chris Rump is also my cousin. So I'm sure he'll appreciate me, having him in this presentation, but he's my cousin. So a lot of times you don't see Chris Rump. So, he deals with, some of the players, he talks to the coach, but he's normally in the skybox, right? You don't normally see him, but he has a particular, set of skills. But what I'm not is Philip Fulmer, like the head coach, right? So the head coach, after I suggest things as a defensive coordinator, that's how the linebacker should move, just how the cornerback should move, right? That's through my experience, expertise, and all that kind of stuff. And then Philip Fulmer, head coach, whoever that'll be, like, all right, let's play ball, right? So again, I'm not normally like like seen in this, right? So for this analogy, and since we're in Knoxville, Tennessee, I want to infuse sports because I am a cultural organizer in the day, so I want to infuse culture in this. And again, I don't want this to be dry. I'm more like my cousin, and not just by blood alone, right? In position, in methodology, not Philip Fulmer. Maybe one day another capacity, but right now I am Chris Rump. I am a cuz right now, right? So it's a little analogy, and I hope everybody got that. I won't assume everybody are football fans. I know we're in Knoxville, Tennessee. I'll be surprised if you don't get the analogy. I can talk to y'all about it later once I'm back at home. I am also at home too, so if y'all see statues in the back, I'm at my mom's house. It's our Hall of Fame. I won't get into all things, but my mom's also a bodybuilder. So if you see some statuesque, it's not me, it's my mom. So yeah. All right. So Reimagining Public Safety. This graphic was made by one of our coworkers, Daphne, and really it shows how interrupting the cycle of community violence, dismantling systems of inequity, and sustainability, they all work in tandem. Right, so as seen by this design, it's all of these is how the economy works, right? So acknowledging that 42%, Black people in the city are below the poverty line, but also reshaping juvenile and criminal systems, a coordinated crisis response team. So when the shooting or homicide happens, who are you going to deploy in the next 72 hours? Also with the street outreach, violence interruption. But also, how do you fund all this, right? So I don't see this $1 million being the end all be all. There goes sustainability, but also collaborative public safety funding models. So it's also, and I'll get to that in a second, is funding the groups on the ground who's trying to get the work done. It's a little bit of capacity, right? The groups on the ground, right? And I'll go a little bit deeper. And I'll go to some examples of what these are, and some city kind of examples, and then we'll go into questions. I'm at 6:34, so I'm pretty good on time. So yeah, interrupting the cycle of violence. So this deals with leveraging political and financial capital to invest in solutions. And I'll keep on saying this. I will keep on saying this. Supported and led by community members and community-based organizations that represent and work directly with individuals most impacted by community and state violence. Right, I want to make an emphasis on that: community violence and state institutional racist violence. And this deals with how do you stop the bleeding today, right? So that more immediate short-term responses to violence, and that includes this violence interruption, street outreach, hospital-based intervention, diversion and alternate pathways, coordinated crisis response teams, and lastly, those public safety funding models, right? So again, it deals with how do you stop the bleeding today? And it really leans on the people on the ground who are touching these people in these neighborhoods. But at times, there are also people who have been affected by this, right? So some examples of that. So what is violence interruption? So violence interruption, street outreach are sometimes interchangeable, but sometimes they're not. But this picture is from Minneapolis, so the Minneapolis street team. The shirt they have, Minneapolis Us, play on the word Minneapolis, is actually from a campaign, kind of a communications campaign that we worked with the city of Minneapolis to kind of form. This was a little bit before the killing of George Floyd. So this is around February of last year. So we worked with the communication department, Mayor Fry's communication department in Minneapolis, with the comms consultant to come up with this campaign. So going back to sports, when you wear a jersey, a Vols jersey, you are showing your commitment to the Vols. So with this Minneapolis, you're showing a commitment to violence interruption. You're showing your loyalty and commitment to violence reduction. So that's what these shirts are. But community engagement at the core of violence interruption. and it stops the violence before it occurs, right? Hence the name. And it prevents its spread, because again, the spread goes into like the public health kind of crisis, right? It's community violence as a disease. It's about interrupting ongoing conflicts and developing community norms towards avoiding violence. So before anything pops off, these violence interrupters come in and try to mediate. So to train that mediation, also have situational awareness to assess violent and potentially violent situations. So again, before anything pops off, these people are out there and deployed to talk to the people, build with the people, mediate with the people, and then see what else is needed, right? And also, these are credible messengers. So these are people that have that cultural capital in neighborhoods. So again, with outside the Knoxville, so the people like in East Knoxville, Mechanicsville, Lonsdale, they have that cultural capital. May not have a PhD in academic sense, but have a PhD in people. They have a PhD in building relationships, right? When you see this person, so I know what this is, so I'm more likely to listen to this person. Or that person can also be trained in how to mediate situations. They already have that situational awareness. That's that street knowledge. Next is street outreach. So they're kind of the same, they're kind of not, right? Sometimes interchangeable. But these are some street outreach workers from Chicago, and they're pretty much what they are. They're pretty much health workers, right? We don't see them any different from any healthcare providers, right? And they use a public health approach to violence intervention. Again, beginning with the premise, as I said before, that gun violence is a contagious disease, a spread that can be interrupted. And they deal with not only immediate crisis response, right? So when something pops off, but also long-term stabilization, support individuals, communities affected by gun violence. And like I alluded to before, these outreach workers are similar to case managers, they're connectors, they're behavior coaches, and they're also mentors, focus on short-term and long-term risk factors for violence. Again, sometimes they're violence interrupters, sometimes they're not, sometimes they're interchangeable, but they have a particular set of really, sometimes the skills are the same, but the goals are kind of different. And kind of lastly is that hospital-based violence prevention. That's a little bit more costly, but it also deals with everybody who's been shot go through the hospital system. So how do they intervene? So these programs focus on the role that medical staff and community-based partners can collaborate to reducing violence with young people. So they also have a sense of interruption. So again, when something pops off and somebody's in the hospital, the hospitals are there to intervene. So they're not just there just to treat and to care. They're invested in community violence. All right. So they have 4 ingredients: intervention, right? That of course the care, right? So we actually all treat and care people, you know. Next is the follow-up. So, you know, once it, you know, hopefully this person be okay, what's the follow-up from that, right? That deals with not only going on with their home, but again, violence interruptions, so where there's no, you know, try to intervene in any kind of retaliation, because again, stuff spreads. But also addressing the social determinants of health as it relates to community violence. And this group is, they're from Detroit, and it's called DLive in Detroit. There's also examples of hospital-based intervention in Virginia as well. And also in Minneapolis, the Next Step program. So as American Candy said, stuff that's worked in these other cities, it can work in Knoxville. Of course, it has to be tailored, you know, so you have UT Medical Hospital, you have Fort Sanders. I know there's others. I've been out for a while, but I know UT Medical Center, Fort Sanders, some other hospitals that it could potentially be partners in this work. But again, having them being partners of this work gives another kind of layer to the systemic and institutional ways of preventing violence, right? And coordinated crisis response team. So within the 72 hours of a shooting, I'm sure you all experienced that with these last couple of shootings. It's stressful. It's stressful from social media, because you know a lot of times the victim is identified on social media before the news bring it out. That's traumatic, and then the scrambling that happens and trying to get on top of the situation. These coordinated crisis response teams are ways to respond to that. So is deployment of resources by cross-sector of partners. I keep on saying that within the 72 hours of an incident, co-led by community-based partners who specialize in violence interruption and street outreach work. It's also accompanied by a communication campaign and raising awareness of that epidemic of shooting and homicides. So more asset-based framing, so not to demonize the community, you know, as it has been lately. Any kind of shooting near Austin East, they name Austin East. That goes into bad stereotypes around Austin East, and Austin East is nothing like that, right? But asset-based framing does not demonize a school, and not put a school at the center of community violence, right? So a marketing kind of communication campaign is essential. And these systems focus on promoting peace, celebrating life, decreasing retaliation, providing trauma supports, also wraparound services for individuals involved, family, friends, and community. And some examples: the Neighborhood Resilience Project in Pittsburgh, Pennsylvania, then also Life Camp in New York City. Some of these projects are integrated in cities, but it's also co-led by people that's on the ground who's already doing the work, that may have the knowledge and skills already, right? Just need like a little boost, and that boost is really more support, and not just by financial, but getting the people behind them to where these systems are the forefront before anything else. And lastly, these public safety models. So again, I'm emphasizing Minneapolis in this, as it's one of our partner cities, but it's also, they've been through a lot, again, with George Floyd and everything else. But these funding models invest in community-led and/or supported violence prevention intervention strategies, and working side by side with cities. So not the city owning everything, it's co-developed, it's co-owned. Financial resources. Also randomly, if there's a ice cream truck that comes by, you know, disregard it. It also deploys participatory budgeting. I know there's been some folks last couple of years who've been emphasizing participatory budgeting in cities, city councils, county commissions, but it gives community members the ability to make decisions on how it should be funded. Like, it's leaning on the leadership and the knowledge of people that's already there. These people know where the money should go. Listen to them, but that's what participatory budget is. And there's also practices and programs that aim to implement that model. Not just the money, but it's about feedback, representation, transparency, and equity throughout the entirety of the funding process. So as you know, processes are made about how the money is allocated, public safety funding models bring all the poke in it, you know, from the barber to the candy lady to the kid and everybody else. Kind of the methodology with that, I don't read everything, but kind of mechanisms for that is community advisory committees, councils of boards, the youth council, survivors of violence, town halls and summits, surveys, interviews and listening sessions. There's also door-to-door canvassing, like, you know, like you're running for office, and neighborhood circles, you know, through the Office of Neighborhoods, you know, something like that, right? These are all that kind of ideas that can kind of happen in Knoxville. But again, it goes into, heck, let these folks decide, like, you know, where money should go, right? So next is system of inequity. So we're getting to how we stop the shooting and the deaths and the bleeding for the near future and for generations to come. putting Highlander in my language, but it is for generation to come. But our goals into boosting education. So tackling disparities, not only in educational outcomes, but also discipline. Again, I was the co-chair of the DEO task force. Intervening in those disparities leads to more education. Of course, there's the money as well, but it's also policy. Expanding healing-centered engagement. So again, as stuff goes on, healing is paramount when it comes to not just the immediate incident, but also how do you address the healing as we go on with this plan? Because as I said before, you can have all the policy in place, you can have all the money invested, but if people are still broken and battered, then this is a waste of time. The next is building an inclusive economy. So it deals with, again, what it is poverty, is housing, it's investment, is entrepreneurship, is everything, it's jobs, of course. As I said before, reshaping criminal and juvenile justice systems. And then lastly, bolstering family support. So also another thing about me, I don't know if she's on here, or either one of them, but working with people like Zenobia Dobson and Terry Walker Smith with moms, I am known as Mr. Mom. So whatever they tell me to do, I kind of do it. All right. But also speaks into leaning on these families who are most affected to be the drivers of this plan, to be the drivers of decision making. And a couple examples of those, before I get into that, we see dismantling the systems of inequity through this iceberg model. So from the top, it's events. So what happened? Things that could be seen. Next is kind of patterns. So what has been happening? What are the trends in a particular issue? Next is structure. So how is this happening? What would explain these patterns? And then lastly, why is this happening? What is the thinking and what is the impact? All right, so we're going to use this kind of iceberg model to take us through like the next couple of items when it comes to dismantling system of inequity. It's a little bit about the role of healing of gun violence. I won't read everything, but it goes to just healing itself. So it deals with improving and promoting mental and emotional health, well-being, and interpersonal relationships. There's intersections with that in education, not just school therapists, but making sure when there's a trauma-informed in a school, there's a trauma-informed school from top to bottom, from the students to the teachers to the principals, custodians, everyone between. It is a trauma-informed school, and the resources will be towards that. And trauma, so any disturbing experience that results in fear, helplessness, dissociation, confusion, that has long-lasting effects. So people go through it when there's a shooting, but healing is non-linear, and people are still going through it with Xavion, Allen, Johnson, Demetric. Those brothers were killed within weeks of each other. A little about my story also. Last time I saw Xavion was at a Stop the Violence rally because of Demetric. It was the last time I saw him. And I found out about his death at the funeral of Allen Johnson. That was hard. Just imagine the whole community having to go through that a couple of years ago and have to go through that again. So investing in trauma-informed practices is paramount, and healing-centered engagement. And then lastly, with healing organizations, right? So leaning on the people who's already doing the work, that are good in that field, and what else do they need about that, right? So also with the role of healing, it's kind of guiding beliefs. So healing is a journey. It's not a linear journey, but it's a journey. It's revolutionary. It's aspirational. It's individual, communal, and systemic. It's also intersectional. That's what healing is. And a little bit more, I don't have slides for everything, but just to go back to build an inclusive economy. So again, I know some of this. So again, not to be, I try not to use violent language, but not to reiterate the fact, 42%, it should not be a talking point anymore, right? It should be a clarion call for everybody to get on board to reduce that. It was 40% in 2000 when I was a kid. So for 20 years, it got worse. So the thing is, how do we intervene in that? It's not too complex to say. When communities are invested, no violence. This is really that simple. The fact, that COVID put a lot of people out of work, parents, kids, so that economic stress of not working and not knowing when the next meal is going to happen, and then even the stress with stimulus checks. So every time, you saw an article online about a possible stimulus check, it's a lot of stress on people, right? And it's not just the parents, it's the kids too. So COVID and the after effects is also like the cause for a lot of this killing. But the disparities are there. So disparities with Black people being the face of COVID, Black people being the face of poverty, Black people being the face of miseducation. All these disparities, the common theme is Black people, and that is entirely wrong. But also disparities in the justice system, right? So it's really about decriminalization, rehabilitation, and really just questioning if prison and incarceration, does that really work? The prison been as long as I've been alive. Crime's still happening, people still get killed. So we got to be more creative than that, right? And then also I want to say this too, as I transition, this will be a learning series. So this will be, we'll go in depth more about these things. They have some experts, actually have some of you all kind of present too, right? So it's also leaning to what, leadership y'all have already, right? So lastly, as far as like how we see the 3 key areas of reimagining public safety, it's estimating the cost of public safety, assessing city and philanthropic spending. These foundations are off the hook, right? Not just cities and counties, but these foundations too, because by law, as my previous job was a fundraiser, these foundations got to spend the money, so they got to invest. There's also adopting an anti-racist evaluation framework. I'll say this again, adopting an anti-racist evaluation framework, so looking at policies and practices they're not just racist, but they're anti-racist and have racial equity, and implementing asset-based communications. Just some highlights. Let's get to that. Anti-racist and racial equity policy advocacy. You see the book right here, How to Be an Anti-Racist, by Ibram X. Kendi. So again, it's about that. Just some examples. Just something as simple as there's a list. If I get a chance, I'll probably link it. But I've also going to say this, is that several cities and communities throughout the nation has named racism as a public health crisis. So our partner cities have done that already, as a city council, by the way, and by mayors. I'll let you all know right now, on top of my head, Shelby County, which is where Memphis is at, Memphis itself, I think Chattanooga are the only Tennessee-based cities who have declared racism as a public health crisis. So as community violence is a public health crisis, so is racism. And some cities have declared it, but it's not just the declaration, okay, then what, right? So it's the then what. So to keep that, city leaders have to commit to being anti-racist, not just with who they are, but through their actions and the policy. As y'all know, anti-racism being fighting against racism, and knowing that racism takes several forms. It's not just an actual word, but it's ideas, it's behaviors, it's policies, right? And then lastly, is racial equity, right? Or racial justice, systemic fair treatment of all people, fair opportunities and outcomes for everybody, and not the absence of discrimination, but just also the presence of values and systems that ensures fairness and justice. All right. And as I said before, yeah, also medical associations have also issued statements around hate crimes being a public health concern, right? So hate crime, racism being a public health concern. Again, as I said before, a lot of cities have done this, California, Wisconsin, all the way to some Knoxville neighbors. So again, as this protest says, racism is a public health crisis. That's just what it is. Just to highlight a little bit more, I'm getting close to, okay, I'm still good with time. Estimating the cost of public safety, there's a report that the city of Philadelphia has done, and it could be a neat project. I don't want to put homework on nobody, but it's something that'd be good to have. And this goes into partnerships. So not just the city of Knoxville, you have the University of Tennessee, you have Lincoln Memorial, you have Mississippi State. You got a lot of students that we could probably lead on for this, and I'll say this. What is the economic temperature for a life lost in Knoxville, Tennessee? Like how much it really cost? I'll say this off the rip. I use slang, by the way. Off the rip, from the jump, is that $24 billion is spent nationally due to community violence, and that goes with funeral costs, lost wages for both sides of the gun, insurance premiums, and then of course, as many of you all know, property value goes down, the neighborhood goes down, that leads to gentrification, right? That bad word. So what other cities have done is assess, again, just how much it is, right? How much it is for a life taken in Knoxville. I'll say on top of my head, in Mobile, Alabama, it's around $700,000 for a life taken in that city. And of course, cities like Stockton, California, Philly, we're talking about 2 to 3 million for one life taken. I'm not talking about multiple lives. I'm talking about one life taken. And those are everything I said, but also lawyer costs, right? But also, what does investment look like? All right, so I don't know what it is for Knoxville. I'm sure it could probably be close to $1 million or more. It could not be. But I'll say this as a spoiler alert: investing in saving lives is a lot cheaper than lives taken. Stuff is cheap. It's cheap, compared to not just the numbers lost, but the trauma that goes with it, right? It's much easier to be here, to work for yourself, and have adequate housing and all that kind of stuff. But it has to be on paper. So at least this, and I always make this analogy, I don't have a cup of water on me, but if you go to people, lawmakers, and say, okay, what we're proposing is cheaper, it saves lives, it boosts the economy, which y'all like, right? Boosting the economy. If they say no, the conversation you got to have, right? Maybe conversation people don't want to have. But it also goes into how, and I don't want to just use the T word, but it's taxes. Some cities have used taxes, as a way to fund it. Oakland has used actually the parcel tax to fund violence reduction work. I think that was in the 2 to 4 million price tag. But it's through the parcel tax, so it went through sales tax and all that kind of stuff. And then lastly, again, with foundations, again, it is by law for them to spend, so they have to invest too. I know there's a number of foundations in the city, whether it's public, private, community-based organizations. I know it's been mentioned around United Ways about investing. That's what they do, right? So back in the day, a lot of foundations were actually on the ground with protesters, so they knew what was happening. But now it's kind of up to all of us to make that case. But again, I applaud those who are investing already. But you gotta do more. This is what it is, right? And then lastly, asset-based framing and communications. I am happy to say, and I don't know if it's subconscious or on purpose, I have not heard the term black on black crime in a long time. that in itself is a victory, right? Because in the past, Black on Black crime was used to pathologize Black youth, and it leads to bad policy and practices. It leads to a broken windows theory. It leads to stop and frisk. It leads to a lot of these nonsensical racist policies. But framed in more community violence, and this naming both sides of the gun, whether you're the victim or the victimizer, it is by a design of institutionalized racism, under-resourced communities that set the stage for the violence decades before these people are born. But asset-based framing includes the people most affected, their stories, but also, again, with the coordinated crisis response systems, it celebrates life. It empowers people. It brings everyone together. It's culture, it's art and culture as well, right? And again, it is an innovative way to make the case that the public safety model when it comes to community violence, innovative ways to where generations from now, they won't be thinking about incarceration. They won't even think about disparities and the suspensions and expulsions and all that kind of nonsense. They won't be thinking about that if we keep on about the asset-based framing, not deficit-based framing. That's what we got to do. And let's see what else I got. There's some other resources. I won't get into that. I know we're getting close to time. So a little bit about our programming. As I don't just do city outreach and engagement work, we have a Roadmap Academy. So as I said, with our city outreach and engagement, this is a more kind of intensive outreach and engagement. It's a year-long kind of campaign. I think Knoxville was in the academy maybe a couple of years ago. Really what I like is the Young Leader Fellowship. So Highlander has Seas of Fire. So it deals with youth organizing with young people all across the region in Highlander. With Cities United is national. So we have 3 cohorts. I was actually a part of the formation of the cohort. I wasn't a part of it, the cohort, but I was a part of kind of like the formation. So that kind of youth voice. I was a part of that kind of convening when I was a young person. I kind of aged out, but when I was a youth, a couple of us came together and started to think about, well, how do you keep young people engaged? Well, you got to pay them. You got to pay them, but also keep them engaged, right? So, but also leave room for autonomy and not to dominate as older adults. And that led to the Young Leader Fellowship. So there's 3 cohorts. We have our 3rd cohort going on right now, 18 to 24. That includes all genders in this. And just some highlights. One of the fellows is the youngest elected official in Pennsylvania history. She's 21, but she won at 18 years old. I should be her mentee, but she chose me. I'm her mentor. So we also have somebody who is a young leader, but also a city lead, right? So somebody that's in their 20s that's doing what Kathy and LaKenya are doing. Bear in mind, LaKenya and Kathy are still young at heart. Don't get me wrong, but somebody in their 20s, right? They're still young. I want to get beat up, right? So those intersections work, right? There's some organizers. So somebody who's been Louisville, Kentucky, that uses his voice in media to talk about Breonna Taylor and leading the march down there. And we have an organizer. We had a fellowship call maybe a month ago, and she couldn't be on the whole time. Why? Because she had a protest for a police-involved shooting in Brooklyn Center, Minnesota. She's only 18. So we have some stars. There's going to be a youth congress coming up with Cities United. I'll invite some folk. Everybody over 25 will not be talking. Only the young people. So they'll be talking about what the issues are, how they're doing work, and actually what the old heads should be doing, right? So we're not talking, we're listening. The Peace Challenge. So it's similar to the coordinated crisis response teams and going about how do you interrupt the violence and stop the bleeding today. It's actually about to pop off next week. So we have 10 cities with the purpose of cities partnering with an existing community-based organization. So again, to marry the collaboration piece, because not just on the city, there's also these community-based partners. So it's 10 cities with their partners to start projects and thinking around shooting and homicide responses, and also an awareness campaign. And they'll be highlighting those findings and those projects by the national convening virtually in October. Community Partner Network, which I've kind of spearheaded. I formed a committee of 10 folk, one from Knoxville. She's 24 years old, from the Justice Inc. Also from Kingsport, my dad's hometown. And the purpose of how to build out community-based organization, not to dictate, but really how do you provide any kind of capacity for emerging organization that just needs this extra tools, right? Like anything else, like popular education, the call's already there, the fire already there. So what extra is needed? And the purpose is start building out the network and what it looks like. And then lastly, and it goes into inclusive economy. Try to get it out the way. Is the Russell Place of Promise? So Russell is considered the Harlem of the South. Russell is a community in Louisville. I think it's I would say it's comparable to East Knoxville. Muhammad Ali went to school there. There's a whole bunch of like dynamic people from Russell, and they're dealing with gentrification. They're dealing with a whole bunch of issues. But Place of Promise is an economic justice-based initiative. It's all about investing in that community, with about $1 billion in investment in that city, that particular neighborhood in Louisville. So again, it can happen in Knoxville, but not happening already, right? Never want to assume. So this is all we do. There's going to be some expansion, some transition. So there'll be new faces at Cities United. So with the Young Leader Fellowship, we're going to have a young person take over that. I've been doing some of the fellowships, but again, I'm in 36. So this young person will be taking over because that youth leadership pipeline, she was in the first cohort. She was consulted as a facilitator for the second cohort last year, and now she's staff. So that speaks into the power of youth investment from the first cohort. Now she's staff, and and she keeps me in line. In fact, I was doing a convening, and she was texting me, keep me in line, make sure I'm on my game, because it was Ramadan, and my brain was not firing, So, but at least like that collaboration within us. And as you see by the screen, this is actually from the Knoxville convening in 2018. See Sam Brown up in there, some other folk I know, and then from then on, it was in Hampton. And you see Merrill here, like to the far right. Again, that was in Knoxville. The last one was in Louisville, but it was virtual. This year will be virtual. Hopefully, as people get vaccinated and people are okay, we can meet again, because that's where like the spirit of convening is. Hopefully you all can come in varying capacities, but of course, and everything is all cool and everything. But also we have 130 cities. I also want to mention that I have 12, 15 myself, probably counting, right? But it's also regional based kind of partnerships. So it could be something cool with city and county, Knoxville and Knox County, King County, Washington, that deals with Seattle, Kent, Buren, Federal Way, all within Southern King County. So it deals with not just collaboration, but regional advocacy and aligning everybody together. And also, have it to be a kind of statewide issue. There's been some statewide engagement in Texas, in Ohio, and there's some other, I think also there's a regional kind of gathering going on in Orangeburg, South Carolina, where my cousin's from, and my mom's side. So from rural to urban, to big and small, these cities are working. But again, it's collaborative, and the community is all up in it, right? And more on Cities United, info at citiesunited.org, at Cities United on Twitter. And yeah, that's kind of it from us. So we'll entertain some questions. Y'all just let me know. But again, just wanted to say over and over again that this will not be possible without community engagement, community driving it, because all the way from Brittany Daniels up until now, even though this is rough, this is heavy, this is the time to do this. This is absolutely the time to do this. We have the right people here, and we just gotta get going. The urgency was yesterday. It was the day before. It was last month. But I am optimistic because I'm allowed. That's why I came from James Baldwin. So you know, it's gonna be hard. I'm excited to get this going, and I hope to be in this journey with you all, as I've always been before I moved, right? So whether I had the megaphone on or whether I had the tight tuxedo, I've always been with y'all. So ain't nothing changed. So I'll stop right there. We're at 7:13. So any questions? Well, Debbie can name them out, or yeah, we can kind of go from there. So.
Sure. We do have a few questions. So the first one from Sarah is, does the city have plans to designate a certain percentage of funding to new grassroots programs and organizations? I think this is a wonderful opportunity to pilot new ideas in addition to those which have a history of being funded, i.e. Crime Stoppers. Who would like to answer that one?
So I'll jump in. This is LaKenya Middlebrook. I'll jump in, and then Kathy, you can add or correct anything that I may say. There is not a specific designation in terms of a percentage. The purpose of this funding around interruption work, most specifically, is geared toward developing programs that may not already exist and building capacity for programs in our community that are doing interruption work that may need further resourcing and building. And so the intention for this is geared toward building out, like I said, newer programs, and really the idea, and I think this may also kind of speak to one of the later questions that I saw around how the money is going to be. I think there was a question about whether or not the money was going to be for law enforcement. This is especially geared, like I said, toward community-led interruption work. And a big part of determining what those strategies are and how those efforts will be resourced. We'll be working with members of the community, as was kind of said at the top, to determine first and foremost what strategies will work for Knoxville, what those will look like, and what resources need to be applied to accomplish that. And so again, as we continue to say, and we know that there's a great urgency because this is an issue that every day, I think, from my understanding, I think there may have been a shooting incident today that did not involve fatalities, but any shooting incident is traumatic, and I know that personally. But we also want to make sure that we build out right and that we get it right. And so we are still very early in this process and are going to be very intentional about working with members of our community, as Andre said, to make sure that these are efforts that are, one, going to work for our community and that are community led, and that we are resourcing them both from the city side, also working with our county partners, also working with, other funding organizations and private donors to bring resources into the organizations and programs that are going to work, whether those programs exist now or are going to be built out to meet this need.
Okay, I think the next might be a comment based on what you were talking about, Andre, about the cost of a life. Forget You Not, which I believe is Raquel, said exactly that is why several $1 million needs to be directed specifically for prevention, intervention, and it's cheaper than a death or lifelong disability as a result of gun violence. Do y'all want to add anything to that?
Oh, I can. I think there needs to be a report made. I mean, not something I could suggest for anybody else, like for any homework. There should be just a report. So it gets to like, and I think it speaks to the urgency. We not just losing lives. I mean, this is a moral conversation, but I think people will probably I'm not gonna cuss, but, you know, they'll probably shake at the fact that we're losing so much money as well, right? Not just like, again, individual, but East Knoxville, Lonsdale, Mechanicsville, they've been under-resourced for a long time. So if you do the math, then the under-resourced communities have the most violence. Again, you have to be a math major for that. So I think a report will probably be neat to have. And I think that will also get into, you know, having some of those community people to be a part of that. It's like that participatory action research that Highlander does, one of their methodologies. So, yep.
Okay, I'm going to look for some questions here because we're short on time. Let's see. Okay, I think this one's answered by Rick Held. The mayor stated that the city was budgeting $1 million. How much of it would be going back to law enforcement? And LaKenya, I think you said none. Is that right? In this project? Okay. Let's see. Does Cities United do a post-implementation assessment? That's from Brittany.
Evaluation, yeah. There's some. Well, we don't do the actual kind of evaluation. We'll kind of you know, if there's a way to develop any processes for you all to do that, right? So it's kind of like that. So it'd be evaluated, but really developing process for, like, you know, city and the folk to do that, you know. So I'll just say, here you go, and kind of go from there. Yep. So there would be evaluation process, but really not us doing that, but really seeing what works with city folk. And if y'all have a way of developing that process, hey, have at it.
Does anybody else have any questions for the panel?
As you wait, Debbie, I also wanted to emphasize, and this is my activist and organizing head or hat on, emphasizing coalition building as it comes to this. Not one group will be able to solve this. So coalition building is extremely important. I know it's been happening already, as I know folks. So yeah, coalition building is extremely important for collective advocacy, for collective building, and really to take care of each other more than anything. Because as this stuff going to go, when I talk about the trauma within communities, there is trauma doing the work, particularly if you're, you know, you're among the oppressed people. When you're among the oppressed people and you're doing something that deals with lives, you get traumatized, get burnt out. You want to quit. I can't say that hasn't happened to a couple of people on here a couple of years ago. You know, so you gotta take care of each other. You know, I'm not getting on the soapbox, but I think just that coalition building. So even before the work, if it wasn't so many people, I will ask everybody how they're doing, what's new and what's good. That's how I feel. So let's take care of each other and yeah, build within community, build within coalition, get everybody involved. Yeah.
Let's see, I've got someone who is thanking you. They had to hop off, but thanking you for an honest and forthright presentation. Another question from Rick Held. Can we get an overview of what happens over the next year with this work? And what are the capacity, oh, phases and steps.
I'll take a stab at this one, and I'll also, Andre, if there's anything you would like to add to it. But again, we are working on this stakeholders meeting that is coming up. This group will be disseminating, I will be disseminating all information to this group to be pushed out. But if you are interested in a deeper, more involved in engagement of this particular type work, please let me know. Again, my contact information has been put in the chat, but I will reiterate it. It's kmac@knoxvilletn.gov. Also, my personal cell, I do not care to give it out, is area code 865-684-6565. I do want to be accessible for any questions. I also want to make sure that we're getting the information to those who are most interested in this type work. Thank you.
Well, cool. Maybe not hit Kathy up like late at night too. I mean, you better than me, but just want to put that out there. But also, yeah. So I'm reiterating the 6 milestones. So this would be like a guide as to kind of like next steps. So Kathy already alluded to it. The engaging key stakeholders is normally part 2, but because building public will and community buy-in is one of the most important things in Knoxville right now. So kind of expedited, and they go kind of parallel too. It's not like one after the other. Sometimes they go parallel, but I think it's also the data, and I think some of you all has some of the data, but not just the shootings and homicides, but again, it's also the protective factors, the groups on the ground is already doing stuff, the economic situation, education. So the totality of that, this is the story in Knoxville. Again, the direction of these key stakeholders, and not just be meeting to be meeting, because I know all you all have been meeting and Zoom to death. So direction and vision, right? It goes to oversight, right? So how do you evaluate? How do you keep city leaders accountable, right? But also how do you keep each other accountable, right? So as community-based organizations, you're gonna be putting the work too, right? So you got to hold yourselves accountable as well, right? And a lot of resources and how we implement everything. At the center is public health planning, and also I appreciate the talk around me being honest, because in the day, again, when Zay, that was my mentee, right? So just for his honor and all the people, I'm invested in this, right? So not just work. I'm particularly invested in this. So I'm particularly honest, because I'm not elected, so I'll just say whatever, right? But because I've seen the worst. I've seen how systems is kind of in the bureaucracy, kind of like messed up momentum. But also know, that we've had wins before, right? For the abolitionist movement to the Black Lives Matter movement until now. So being active as an organizer, we emphasize around that transparency and being who you are. So yeah, thank you.
And it looks like that might be it for the questions.
I'll stop sharing the screen then. Cool.
Well, again, we thank Andre. Would you get ready to say something?
Oh no. I mean, I'll look to you all to kind of like wrap up. But yeah, just thank you all for dialoguing and sharing this space with you all. Again, as I know most people already, it's always good just to talk with people. But again, we can do this. We just have to keep at it, be consistent, and not get burnt out. So self-care is extremely important. We don't want nobody burnt out, and don't let anybody else burn you out either. But take some time to take care of yourself and have some escapes, because we need all y'all here. I need y'all. I need us. That's it.
Absolutely. And I'll add to that, we need each other. I will not add anything else. Thank you all again for your time on tonight, and we hope you have a wonderful evening. This concludes this webinar. Thank you.